Has someone you love started showing subtle but concerning changes over the past year? Many believe death in old age strikes suddenly, but the body often sends quiet signals months or even a full year before the final stage. The trouble is, most people don't notice because these signs seem small at first. Only later, looking back, do families see the clues, but by then, it's often too late to prepare and make last memories count. In this video, we explore 5 key warning signs that often appear a year before an elderly loved one passes. Some might be things you've noticed but dismissed as part of aging. Others may seem insignificant, but actually show gradual decline. Recognizing them early lets you provide better care, create lasting memories, and ensure your loved one's final stage is filled with comfort, dignity, and peace. Stick with us until the end. These 5 signs help you prepare emotionally and practically. When you know what's coming, you won't be caught off guard. Instead, you'll make the most of the time you have left. Let's begin. Number 1, significant weight loss. One of the earliest and most telling signs someone may be approaching the final year is unintentional weight loss. It might start small, a belt that fits looser, clothes hanging differently, appetite fading. Many chalk it up to aging, but losing weight without trying is rarely normal. It often means the body isn't absorbing nutrients, muscles are wasting, and systems are slowing. Aging naturally brings muscle loss, but when it happens too fast, it signals something deeper. The body may struggle with digestion or protein absorption. That loss of strength doesn't just make moving harder. It increases fall risk, weakens immunity, and raises infection vulnerability. Appetite also changes. Many elders don't feel hungry like before. Taste fades, food is enjoyable, and meals shrink. These aren't just preferences, they're biological shifts. When the body starts to shut down, it stops triggering hunger signals. The result, less energy, less strength, and declining health. Underlying illnesses often disguise themselves with weight loss. Conditions like cancer, heart failure, or kidney disease can progress long before obvious symptoms appear. Depression or cognitive decline can also reduce eating, setting off a spiral where the body doesn't get enough fuel. Families often respond by offering favorite foods or protein shakes. But if weight continues to fall despite efforts, you're seeing a message, not a lack of effort. At this stage, focus on comfort, easy-to-eat foods, and hydration rather than force-feeding. If you notice significant weight loss, particularly alongside less eating, feebleness, or reduced movement, it's time to act. This isn't about appearance. It's a signal. Understanding it now lets you prepare with compassion and make each moment count. Number 2, extreme fatigue and weakness. One of the most noticeable changes in someone's final year is profound fatigue that won't go away with sleep. This isn't normal tiredness. It's exhaustion that makes simple tasks feel impossible. Getting out of bed, walking across the room, cooking, dressing, even talking becomes deeply tiring. This isn't just aging. It's the body conserving remaining energy. As organs slow, systems prioritize survival. Hearts pump less efficiently, circulation weakens, and muscles receive less oxygen. That's why many elders near end of life feel weak, unsteady, and unable to engage in once routine activities. Metabolism also slows. The body still produces energy but uses it differently, preferring preservation over action. You may see seniors sleeping more, taking frequent naps, and struggling to stay awake. They may have sudden energy crashes, bright one moment, drained the next. Above all, it's emotionally taxing. Many seniors who once thrived now feel embarrassed or upset. They can't do what they used to. They might withdraw from conversations or hobbies, not from lack of interest, but from lack of energy. This often leads to loneliness, which worsens decline. For families, the change is heartbreaking. You might think encouraging activity will help, but forcing it won't. What matters is respecting their limits, helping them rest, and prioritizing comfort and connection over productivity. If deep, ongoing fatigue is relieved by rest, it's a key sign of major transition. Now is the time for gentle presence, peaceful moments, and reassurance. Because it's not about how much they can do. It's about how loved and supported they feel. If you're still with us and finding this helpful, comment number 2 below. And if you haven't subscribed yet, please do and hit the bell. Your support helps us keep making content that uplifts and informs. Number 3, increased cognitive confusion or withdrawal. As someone nears life's end, one of the most striking changes is how they think and connect. Someone who's been sharp may start forgetting more, struggling with conversation, or becoming disoriented. They might repeat themselves, lose track of time, or not recognize familiar surroundings, sometimes months or even a whole year before the end. This isn't normal forgetfulness. The brain needs constant oxygen and nutrients. As circulation weakens, cognitive function slows. They may become confused, indecisive, or not recognize loved ones or places. Sometimes they'll seem alert for moments and lost the next, brain fog setting in. Emotional withdrawal is also common. As the body winds down, they often lose interest in social interactions. You might see them talking less, avoiding company, or sitting quietly for hours. It's not indifference, it's exhaustion. Loud or busy environments overwhelm. They often retreat inward. Mood and behavior may change too. Some become irritable or anxious. Others calm, detached, or emotionless. This isn't personality. It's the brain coping with bodily shifts. They may not react the way they used to. For families, this can feel like losing them before they're gone. But it isn't under their control. Instead, try to get them back. Meet them where they are. Speak softly. Offer comfort, and accept that they can still feel love, even if words and memories fade. If you're noticing forgetfulness, confusion, or emotional withdrawal, don't ignore it. These are early signs. Now is the time to create calm environments, share memories gently, and prioritize closeness over conversation. Even without words, love and peace remain. Number 4, frequent infections and slow healing. As the body begins winding down, one of the clearest signs is a weakened immune system. Someone who used to rarely get sick may suddenly catch every cold, flu, or minor infection that comes around. What were once quick recoveries stretch out, and small wounds, cuts, bruises take much longer to heal. These aren't random. They're warning signs that the body can't repair or defend itself like it used to. Repeated infections like pneumonia, UTIs, skin infections, even oral issues start appearing more often as immunity weakens. Families sometimes dismiss them as isolated illnesses, but when infections recur or linger, it shows the body is losing its fight. Antibiotics may no longer work as well, requiring stronger drugs or longer treatment. With slower circulation and fading organ function, recovery isn't as swift. Chronic wounds also become concerning. Scratches, sores, or bruises that don't heal or reopen indicate poor blood flow. This causes pressure sores too, especially among less mobile seniors, which can lead to serious infections if unattended. Even trickier, infections don't always come with obvious symptoms like fever. Instead, an elderly person may simply become confused, fatigued, or eat less. In seniors, changes in mental clarity often show before other signs. Recognizing these signs early allows you to shift care from curing to comforting. Hydration, clean skin, gentle treatment, and minimizing stress can mean more than aggressive medications that may prolong discomfort. If you found these insights useful, comment number 4 below to let me know you're here. And if you haven't yet, please subscribe and ring the bell. We love sharing content that informs and uplifts. Now, let's continue. Number 5, major changes in breathing or circulation. One of the most telling signs that the body is entering its final phase is a change in breathing patterns and circulation. You may notice slower or shallower breaths. They might pause between inhales, or their breathing becomes irregular, fast one moment, slow the next. Some show Shane Stokes respiration, cycles of deep, rapid breaths followed by long pauses. These changes often start subtly but become more frequent over time. The circulation can also weaken noticeably. Hands, feet, nose, or ears might feel cold, and skin may appear pale, bluish, or blotchy, especially around extremities. That's your body redirecting blood to vital organs because the heart's pumping ability is fading. You may also see more shortness of breath. Speaking, sitting up, or small movements may leave them winded. Mouth breathing becomes common, and simple tasks like walking across a room could become a struggle. Fluid in the lungs may make breathing even harder, causing persistent coughs, gurgling sounds, or chest tightness. A congested feeling isn't just a cold. It often reflects lungs losing strength. Sleeping lying flat may be uncomfortable, so they might prefer resting in a recliner or with extra pillows. For families, this can feel scary. It's natural to want immediate solutions, but often this is the body's natural slowing down. While not reversible, you can ease the discomfort. Cool room temperatures, humidifiers, small sips of water, and sometimes medication or oxygen can help. But the priority shifts to comfort rather than cure. If you're seeing these changes, altered breathing, cold skin, discoloration, it's a sign energy conservation and circulation slowing down. This time is about presence, reassurance, and calm environments where your loved one feels safe and supported. In these final months or weeks, your kindness and comfort matter most. As we close, take a moment to remember these 5 crucial signs: significant weight loss, extreme fatigue, cognitive confusion, frequent infections, altered breathing and circulation. These often emerge during the year before an elderly loved one passes. They may not appear all at once or stand out immediately, yet when you recognize them, you're seeing the body preparing for its final transition. It's natural for families to want to fight these changes, to encourage eating more, exercising, or resisting exhaustion. But sometimes the greatest gift is understanding what the body is signaling and choosing to shift the focus from reversing to supporting. By recognizing these signs early, you can deliver better care, make informed decisions, and ensure your loved one's final months are marked by love, comfort, and dignity. It's a time for sharing stories, being present, and affirming that they're cherished and not alone. If you're seeing these signs in someone close, take a deep breath and remember, you don't walk this path alone. Many have traveled it before, and while it's heart-wrenching, knowing what to expect can bring strength, understanding, and serenity. Thank you for being here. We'd love to hear from you. Tell us one insight you'll use in your life. Your wisdom helps our community grow. If this video resonated with you, please like, share, and subscribe. Your support powers more conversations like this. Thanks for watching, and we'll see you in the next video.